Senator from Louisiana.
Mr. President, I've been coming to the floor to speak about how can we go forward in a way which actually lowers lowers the cost of having health insurance for those who are on the exchanges and begin to build to a future where we lower the cost of health insurance and health care for everybody, whether you're on an Obamacare exchange or an employer-sponsored insurance or you name it. And so we know there's going to be a vote as part of this agreement to reopen the government on what to do about the exchanges. So we need to be thinking and talking about the solutions that are out there that benefit the American people. And of course, what the issue is underlying, people cannot afford their health insurance. They cannot afford their health care. Those are two different things, by the way. The cost of health care is what dictates, theoretically at least, the price of health insurance. If you lower the cost of health care, then you will lower the price of health insurance. I saw this as a physician practicing in a hospital for the uninsured for 20 years. I should say the uninsured and the poorly insured. There have been middle-income people who could not afford their insurance and or could not afford their health care. So how do we get out of it? Well, first, it's complicated. We've got to be creative, and we got to abandon set positions. Sometimes we're in this chamber, and all we do is stick to our guns, and if the other party suggests something, we automatically reject it. We've got to move beyond that, not as, oh my gosh, the other side proposes, I reject, but rather, wait a second, let's listen. Is there a solution here that can benefit the American people? Now, Obamacare tried to make, and has tried to make, health care affordable, health insurance affordable, by just throwing billions at it. And the problem with that doesn't make health care affordable. It just makes the health insurance premium less expensive for those who are on the exchanges. But this actually drives up the cost of insurance for some and does nothing about the underlying health care costs driving up the premiums for others. So what's my proposal? I would propose that we instead of paying insurance companies to manage more of our billions, why don't we trust the American people to manage their own resources, to manage their own care, with something which I call a pre-funded federal flexible spending account. Now let's first talk about the enhanced premium tax credit, which is the center of this discussion. Just a primer. Let's get the basics. There are two types of premium tax credits used to fund insurance for those who are on the Obamacare exchanges. One is the baseline tax credit in the original Obamacare law, which helps pay for the premiums for those who earn less than 400% of the federal poverty level. But that didn't control costs, and so during the COVID epidemic, the Biden administration put in something called the enhanced premium tax credit. It provides some additional benefits for those less than 400% of federal poverty, but it gave additional benefits for those above 400% of federal poverty. If you will, acknowledging that Obamacare had not controlled health care costs and premiums on the exchanges for those above 400% have become unaffordable. So let's be clear. The discussion we're having now is not about the baseline premium tax credits. It is about the enhanced premium tax credits, which started under the Biden administration. So it begs the question, why were enhanced premium tax credits necessary? Well, as we've said, the cost of health care has continued to rise. And you can argue that if you're going to an insurance company and you're saying, we're going to give you more money if health care costs more, that they do not have the incentive to help control those health care costs. Now, I am not here to bash insurance companies. They are essential to our society. So just put that out there. But if you have the choice of giving the money to the patient for her to manage it or giving it to the insurance company, I think we should give it to the patient. So the question is, can we put in programs that lower the cost of health care? How long will they take effect? And what do we do in the interim? Well, it's too soon this coming year to put in programs to lower the cost of health care. but it's not too soon, which is to say we can put in programs that empower patients to manage their costs and give them the money as opposed to giving it to the health insurance company. But to do that, we got to think differently. So, how do we lower costs for the coming year for the individual who's on the exchanges? Now, it's important to realize that the total cost of having health insurance is not just the premium, but it includes the deductible and the copay. So if you can help with the deductible and the copay, that is as effective or even more effective than helping with the premiums. So what I'm proposing is something which actually helps the patient become a wise consumer of health care, helping her with the premium and the copay, working with the health insurance policy, with the health insurance policy, but in a way which lowers their cost. Now, let me be clear. This is not the official Republican position. President Trump has endorsed the concept, but it's not, say, for Leader Thune. But I am the chairman of the Health, Education, Labor, and Pension Committee, which has jurisdiction over this, and we will be having hearings in the near future to address this. And my motivation is as a senator and as a doctor who wants to make health care more affordable for all Americans. So let's discuss what I'm calling a pre-funded, flexible, can you get my marks a lot again? A pre-funded flexible spending account. So first, here's what we currently have: an enhanced premium tax credit, which is going to take $26 billion next year and give it to insurance companies to tell the patient what she can buy and what she cannot buy. Now, I have a typo here, and I fixed it yesterday, but I got to fix it once more. 20% of the money, 20% of the $26 billion going out the door to help pay for insurance premiums actually will go for deductibles, will go for profit and overhead of the insurance company. So let me just change this right here. Again, I had a typo yesterday, I have a typo today. 20% of the money we're giving to the insurance companies under the enhanced premium tax credits goes for profit and it goes for administrative overhead. Only 80% goes to pay for the insurance premium, to pay for health care costs for the person who's the recipient. Let's speak of what I am describing, the pre-funded flexible savings account. Pre-funded because you take the enhanced premium tax credit, instead of giving it to the insurance company, you give it to the individual and her family through a flexible spending account. A flexible spending account which millions of Americans already have.